The healthcare system in Portugal can be especially confusing for foreigners. We get it. It wasn't super clear to me until I sat down with Michael for this video. So will you end up moving here and not getting the coverage and care that you need? Will you end up paying a ton of money or wasting your time waiting for a treatment? There's public and private systems here, and you're going to learn which one you should use and why. You're also going to find out if you need private insurance after you move here. Okay, let's talk to the expert about how you can make the system work for you. Well, Michael, I don't think that I've told you this before, but I don't really understand the Portuguese healthcare system very well. So I'd like you to help me out understanding it a bit better today.
Portuguese system, first, it's very, very different for sure from the American one.
Okay.
And it's different from other European systems. And the thing is that those unique virtues of the Portuguese system are creating a very strange situation. Okay. On one hand, if you are really seriously sick, you want to go and be treated by a Portuguese physician in a public hospital.
Okay.
Which is like kind of surprising. Why not private? So public. On the other hand, if you just want to see a dermatologist, you for sure don't want to do it through the public system because it will take you forever to wait for it.
Okay.
And there are so many small details inside that I'll be happy to explain.
Yeah.
I'll actually make your life a bit of a juggling. Your life when consuming healthcare in Portugal, you need to be a little bit of a juggler.
Okay.
Between the two. So you already understood there are two systems in Portugal.
Okay.
One is the public, one is the private. So what about this public issue? Public system is great, mainly because it's for everyone. Everyone that is a legal resident in Portugal is entitled to care within the SNS.
Okay.
Within the Serviços Nacionais de Saúde. Sorry.
Okay, and we pay into that via taxes.
Exactly.
Okay.
And the payment, actually, it's a very, very good point that you're touching here, because many people are saying, well, we just came to Portugal and we never paid social security, etc. Forget it, guys. You're actually paying with each and every coffee.
Okay.
With each and every thing that you buy on the street, with a car that you just bought, with the apartment that you're renting or whatever. The funding of the national healthcare system comes from our own or our contribution to taxes.
Got it. Okay. That's interesting. I did not know that. Okay, cool.
So here you are. So we are all paying for it.
Yep.
Now, what does it really provide? In theory, the public system should take care of all the 3 or 4 levels of care, meaning primary care, your GP, where you go for just prescription medications, or where you go when you have the cold.
Okay. And
then secondary care, meaning a layer of experts and professionals, your dermatologist that we mentioned before, gynecology, etc., etc. And tertiary care, hospitalization.
Okay.
And there's kind of another layer in a way of excellent centers. As an example, somebody with a dreadful diagnosis of cancer, somebody that would need a liver transplant. Everything is built into the system. Unfortunately, not everything functions very well in the system.
Okay.
And what functions very well are practically 2.5 layers. The tertiary care, hospitalization for something serious. You would many times prefer to be hospitalized in a public hospital. The upper layer of tertiary, meaning, God forbid, if somebody has cancer, if somebody needs a liver transplant, public system for sure, only public system. Actually, even if you have been diagnosed with a leukemia in a private hospital, they would send you to a public one.
Okay, I've heard of this.
And so these are 2. And the other half is half of the primary care. What works very, very well is the e-prescription system. you have a prescription of your medications. If you use your SNS number, your registry number with the national healthcare system, very easy to use. You actually get a prescription on your phone with a code, go to any neighborhood pharmacy, show the pharmacist your code, got your medications with a very little copay or for free,
Right.
and here you go.
Okay.
Problem is that seeing your GP in the public sector
Okay.
or seeing a specialist in the public sector is a little nightmare.
Okay. I don't even have a GP at this point.
Exactly.
Yes.
So welcome to the club. I don't have a GP as well, but we are expats. But believe it or not, around 1.2 million Portuguese do not have an assigned GP. You don't have one,
Yeah.
and that's the problem. So these 1.2 million people
Yep.
are practically left alone. This is a major constraint on the system. Because they they don't have a helping hand. They don't have anyone to manage their medical concerns. And this is a problem.
Sure.
Now, by the way, all of these, and leave alone us that I hope you're healthy. I'm old but healthy. So we get along. But imagine people that are a little bit more elderly.
Sure.
Imagine people that need to see physicians on a weekly basis at the beginning. I don't know. Imagine people that have diabetes, that have some kind of a chronic active medical condition.
Okay.
And they don't get to see a GP for months or at all. And the solutions are, again, very provisory. So all of these find themselves in emergency rooms, totally unnecessary.
Right.
So
Because they basically wait until it's an emergency. And
they
then
wait
go see.
until it's an emergency, or they couldn't find an answer to their needs, so they go to the emergency room because there they at least understand that the emergency room cannot refuse seeing them.
Okay.
So
Got
they
it.
end up sitting in the emergency room for 16, 20 hours because they're not supposed to be there.
Right.
But there's no...
Because what they have isn't really an emergency, so they
it's
triage
like-
or...
Exactly. So
Got
the
it.
triage puts them aside. They wait for I don't know how many hours,
Okay.
and they end up not resolving their issue. So again, this is a vicious cycle that will not get into resolutions in this opportunity, but it is there.
Okay.
The other thing is this secondary level of care. You want to see a specialist. You already know that you have a problem with your knee. You already know that you have a problem and you would need a procedure, a colonoscopy, whatever. The waiting periods in the public sector, on the average, and these are formal statistics, are more than 86 days, on the average.
Wow.
Now, this average actually accumulates those that are concerned more severe or more acute cases or non-acute cases. So if you are just concerned about a skin condition and you want to make your annual checkup of screening for skin cancer, if you didn't schedule it like a year ago, your chances to have it in the near future are somewhere
Slim.
about zero.
Okay.
And the thing is, because of the structure of the system, each and every one of us, when living in a certain place, belongs to a certain hospital. So you can only go there to see a dermatologist.
Okay.
And when you finally get there and see your dermatologist, it might so happen that he doesn't speak a word of English.
Okay.
And this is another issue. But this is how the system works. So just to recap it,
Please.
if there's something very serious, you want to be in a public sector. If you need a triple bypass, this is where you want to do this, and you,
Okay.
of course, will not wait forever because this is urgent.
Is it due to the technology or the facilities? What do they have that make it better than the private?
I'll tell you, the major point, I mean, the doctors are the same physicians.
Okay.
They work in private and in public, so it's the same knowledge, there's the same skills.
Okay.
Equipment-wise, same level. The thing is that private hospitals are not structured in a way in which multidisciplinary teams are available 24/7.
Gotcha.
And when it's something serious, you want them to be available 24/7, and this only the public sector has.
Okay.
So that's the major issue.
Okay.
Coming back, if it's something serious, public, and if it's your prescription medications, for sure public.
Okay.
All the rest private. Let's talk about private. So this sad situation of non-available physicians, etc., 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 drove the system towards creating a large private market.
Okay.
During the past decade or so, the penetration of private insurance, health insurance in Portugal jumped from about 10% to more than 40%.
Okay.
And this is because people understood that, hey, having a private access, a private financial enabler to health helps me get what I need quicker, more efficiently. I don't need to wait. I go wherever I want. I choose the physicians. Oh, great. So practically, there's this parallel system, mainly kind of dominated by 4 networks of private hospitals.
Okay.
KUF, Luz, Lusíadas, Trofa Saúde, and a lot of private smaller clinics, diagnostic center, etc., etc., etc. Now, all of this system is actually driven by the ultimate driver, money.
Okay.
Euros.
Yep.
Or insurances.
Yep.
Or health plans. And this is important to make the distinction between health plans and health insurances.
Okay. So where would Medish fall? Because that's who we have. We have insurance from Millennium Bank. Millennium Bank has a healthcare plan, and it's Medish.
Yeah.
So how does that work?
Okay. So first, my recommendation is not to buy an insurance from a bank.
Okay.
Exactly like you wouldn't put your money with your broker.
Okay.
But this is a different issue. Yeah, Millennium is connected to Medish through AGES, through the insurer, through the underwriter. But Medish is an insurance. What are those health plans? As an example, the networks themselves would have health plans, but these are discount cards. KUF Saúde, okay, KUF as a network of hospitals would provide you with a card. You will pay very little money for it, actually, on a monthly basis, 4, 3, 5, 7, I know what, 9, 10 euros.
Oh.
And many people perceive it mistakenly as an insurance. This is a discount card.
Got it.
Same Medicare, not the American Medicare. There's a Medicare here in Portugal.
Okay.
Discount card. Same a discount card from EDP, the electricity company.
Okay.
Okay, and ACP, the Automobile Club of Portugal. All of these would provide you with some kind of a health plan, but this is a discount card. This is not an insurance.
Got it.
When you go to insurers, so we have several big players. You have Fidelidad with a product called Multicare. You have Medish. You have Allianz. You have Amgen. These are the major insurers that would provide you with health insurance.
Okay.
And again, health insurance, private health insurance is for sure a great enabler to go and to see any physician that you like in any hospital that works with your insurance, of course.
Right.
And this is a great relief in a way. And by far, the pricing of health insurance in Portugal, as a rule of thumb, is around 10% of what you would be paying in the States.
Yep.
So it's very, very fair. But what we would normally suggest and recommend to people, don't jump on the first insurance that somebody provides you with, because it's very attractive. Like somebody says, hey, here's a health insurance and it will cost you 50 euros per month. And you say, what, 50 euros per month? Yeah, where do I sign?
Right.
Don't.
That's what happened to us. That's what we did.
Right. So I'm not saying you have made a mistake, because again, you're young.
Yep.
But the thing is that many people arrive to Portugal already with some medical background and already at a little bit of an advanced age. And here are the major pitfalls of insurers in Portugal. All the insurers, by the way, are structuring their plans and their proposals according to a very simple fact of which we already spoke. Everyone that is living in Portugal as a resident, is entitled to full structure of healthcare on behalf of the government. So insurers do not necessarily give you the whole spectrum of what you need.
Right.
It's kind of an upgrade. And this what creates the small pitfalls. Somebody buys an insurance, he's totally sure that he has everything, and only when time comes, he discovers that, whoops, this is not covered, and this is not exactly there, and this you didn't buy, and so on and so forth. Major pitfalls, two of them. One is age.
Okay.
As long as, of course, you can become a resident in Portugal at the age of 120, and you will be entitled to care.
Is that right? 120? Yeah. Okay, that's on the books.
That's on the books.
Wow.
But if you want to buy an insurance, by far, not all insurance companies would provide you with an insurance plan even beyond the age of 60, 65, 70, whatever. And then actually, if you go like climbing with your age, the content of your insurance plans decreases.
I see.
So very careful with that. More than that, there are insurers that you can adhere to their plan at the age of 60, but then at a certain age, 70 for sure, actually starts after 65, and up to 75, they will start excluding you because of age.
You
they
age
will just
out.
Say, yeah, you age out. They will say, thank you for your business, Josh, no more. And then you're, but I've been paying you for so many years, never used it. Yeah, we understand that. We're very sorry. So please, if buying an insurance and you're kind of more than 20 plus, I mean, above the age of 55, practically, be very careful with those small issues of when will I be excluded or will I? This is one. And the second one, very important, pre-existing conditions.
Okay.
Pre-existing conditions is a very good reason why not to pay for something. And insurers all around the world, in Portugal, like in the States, like in any other place, would find whatever good reason not to pay for a treatment. Pre-existing conditions is like the star of it. So take very good care when buying an insurance. Ask if pre-existing conditions are covered. Majority of insurers would not cover pre-existing conditions.
Right.
I have a small secret to tell you. Your Medish doesn't cover pre-existing conditions per definition.
Okay.
Okay. But again, you probably bought it and you didn't have anything to say, so great, no problem. But if somebody has already something that he bears, like he takes from the past, okay, and he buys an insurance like Medish, maybe the insurance is great, maybe you enjoy it, maybe you have a great application, great, okay. But the main reason why you bought the insurance is not covered.
Right, yep.
So that's the thing. These are the kind of major two things to pay attention to.
Okay. So these are the two systems put together. You have the public and the private. Are there anything else I should know about the system to understand it better?
This, as I said before, when you want to use the systems, you really need to juggle. And let's take a simple example of somebody who is not very old, 58, 60, has diabetes well controlled by medications, had a heart condition, whatever, had a stent placed, and in the past several years he's been having pains in his knee, and the doctor once said, look, sir, you will need a total knee replacement. And what's the journey of this person? So first, again, normally he would come, he will be registered with the national healthcare system, important.
Okay.
There's a process to it. Having your SNS number opens the doors, okay, opens the doors actually to use the system. And this person as well bought an insurance. So you have a 60-year-old guy, diabetes, heart condition, a bad knee, he has an SNS, and he has a private insurance. And then how does the life go?
Yeah.
So all the prescription medications, by the way, given by a public service physician or a private physician, as long as the prescriptions come with your SNS number, You go to the pharmacy, present this prescription or present the code, because it's an e-prescription system, very simple to use, very efficient, and you get your medications for a very little copay or free of charge. Great. Actually, using the public health system.
Right.
Then imagine this same person, God forbid, wakes up at 3 a.m. because he has an imminent heart attack. He would call an ambulance. He will be brought always to the public hospital, and this is the best place to be in this kind of a situation. Mm-hmm. He is having a heart attack. He will undergo a cardiac catheterization. Another stent would be placed, and he will be there in the ICU for a day or 2 or 3, and he will be out, and that's the best place where he could go because of this imminent heart attack.
Okay.
Again, public. When he gets home and he needs to be seen again by a cardiologist for the follow-up or by the endocrinologist for his diabetes, if he wants to go to the public, it will take forever. So here he pulls out his insurance card and goes to see a good cardiologist in a hospital near him, and the insurance pays for that. All good. And then comes a time in 2-3 years from today that he really needs this total knee replacement. Mm-hmm. And this total knee replacement is a procedure that would cost quite a few thousands of euros, okay. Actually 25,000 of euros. But the surgery is not very complicated. It does not require a stay in the ICU or something, major. Mm-hmm. And this guy of ours really wants to do it in a nice hospitality place, okay, and to have a nice meal and to have a private room, and he would go and see his private orthopedic surgeon and schedule a surgery in a private hospital. And again, the insurance here would pay for the surgery. This is exactly why you have this insurance.
Got it.
He will have the insurance in the hands of a very good physician, very good surgeon. He will stay in a private room, have a nice hospital meal, and get out of there. And here you have like this juggling, but yep. This is a wise juggling between the systems.
Yeah.
Prescriptions, something acute, a follow-up on a private, surgery on a private. This is how you play with the systems in a way.
I see. So being able to have your private healthcare, you can take advantage and have the best of both worlds.
Right.
Essentially.
Yeah.
Okay.
Exactly that. But what you really need, thing is that you gain this knowledge after many, many years. And if you really need it today, you need somebody.
I'm trying to gain the knowledge right now.
So this is what I'm saying. What I'm saying is not everybody has the time to learn. The learning curve for some would be longer than what they can afford.
Sure.
If somebody already comes and he has all those conditions, he wants it today. Today, you will need a helping hand.
Yeah.
You will need somebody that understands how to manage it.
Yeah. You know anybody?
Let me think. Serenity?
Serenity. Yeah.
These ones.
Yeah, exactly. So guys, Michael is the CEO and the co-founder of Serenity Portugal, and we have a video that we've done with one of your clients, and Kalie actually did the interview for that video. You can find it right here to learn more about what Serenity does. Michael, thank you so much for your time. Helping me understand this. Now I actually have an idea about it. Appreciate it. Thank you.
My pleasure.